Right. Here we go.
We're ready?
It's still loading, so hold on just a second. Okay, yes. Hi, my name is Nicole Bashiri. I'm the Family and Consumer Sciences Extension Agent in Bath County, and we are back with Sasia Hollenberg, your insurance lady for Medicare Minutes. So she's going to talk about her program for this month, and I will let her introduce herself and get started.
Thank you, Nicole. I appreciate it having me again. And thank you for this great opportunity. So today, our subject is going to be in the Medicare Minutes, Medicare Special Needs Plans. The Medicare Minute is an educational presentation I'm giving each month here in the community to cover different topics. Medicare can be very hard to understand, so I'm trying to help folks to make it a little easier to understand the Medicare benefits and to deal with coverage problems so you get the health care you need and save money. Kind of like save money and be healthy. Please ask questions. You can put those in the comment boxes. You can also private message me and I will help you out. I hope I can bring here some information to you today and teach maybe some new benefits. A little information about myself. I'm an independent broker with active insurance licenses here in Kentucky, but also in Ohio, Tennessee, North Carolina, Idaho, Virginia, Michigan, and Florida. And I really, really, really love to help seniors, especially to make this huge elephant of Medicare a little bit more understandable. My background in general is management, and I live in P6, Bath County in Kentucky. And several folks probably know that already. I'm from Germany, from Bavaria, from the mountains areas. And on a personal note, as you can see, horses are one of my big, my big hobbies. 2 horses, 2 rescue dogs, and a ton of chickens. And I love to garden, can, and horseback riding. So this is just a little bit here, so you see where I live, see a little bit of my critters here, get a little bit of an idea of my personal life. And let's go in here. So let's start today with our program. I would like to step back a minute and let's look at the different kind of Medicare Advantage plans in general. The availability of these plans differ from state to state, from zip code to zip code, and county to county. But in general, we have 5 different Medicare Advantage plans. Don't get intimidated about the big words. Most of the folks are just knowing the little acronyms. So Medicare Health Maintenance Organization, it's a program where you have to stay in the network. Then there is the Medicare Preferred Provider Organization, or PPO. You can there use your doctors inside the network with lower copays or outside the network with higher copays. Then there are the private fee-for-service plans, or PFFS plans. They're very rare. They're not very common. Not a lot of people are using those. And our subject today will be Medicare Special Needs Plan, or also called SNP plans. Then there are Medicare Medical Savings Accounts, MSA plans. But today, again, we're focusing on the special needs plans. So Medicare Special Needs Plans are private companies that the federal government pays to administer Medicare benefits. Like all Medicare Advantage plans, the SNP plans must provide you with the same benefits, rights, and protections as original Medicare. But they may do so with different rules, restrictions, cost. Some of the SNP plans offer additional benefits such as vision, dental, hearing benefits, or over-the-counter benefits. What are over-the-counter benefits? Over-the-counter benefits are that you get a certain amount of money, or a certain amount of money is available for you to purchase things like aspirin, vitamins, etc. All SNP plans are designed to meet specific care needs, and you only can join a SNP plan if you fit that specific needs category, what that specific plan serves. So SNP plans may provide care and coverage, coordination of services not offered by other types of Medicare Advantages. And there are 3 different types of SNP plans. We're going to go into detail in a minute. The chronic condition SNP plans for individuals with specific chronic conditions, such as cancer, dementia, diabetes, HIV, stroke, end-stage renal disease, and certain neurological disorders. Then there are the institutional SNP plans for individuals who live in an institution, such as a nursing home, long-term care facility, or skilled nursing facility, or assisted living facility. And then the third category are the dual eligible SNP plans. These are for individuals that are enrolled in Medicare and Medicaid. So you must have both Part A and Part B to join a SNP plan. And in general, you will continue paying your Medicare Part B premium. Though some of the SNP plans actually will pay part or the entire Part B premium. Some SNP plans will charge an additional premium on top of your Part B premium. Some plans will have 0 premiums. You might be eligible for other forms of premium assistance if you're eligible for a SNP plan. And SNP plans are required to provide always a Part D coverage. Part D is for your prescriptions. You can enroll in a SNP plan if you have end-stage renal disease, if a plan is specifically available in your area. Actually, there will be a change next year. End-stage renal disease, and this is away from everything, end-stage renal disease will be able to go on to regular Medicare Advantage plans. There are changes coming, so I just wanted to bring that up. Your Medicare SNP plan may be an HMO, a health maintenance organization, or a PPO, preferred provider organization. Depending on your plan, you may need to see what we already said in network providers to receive coverage, or you have the option to be going outside the network, like in a PPO, but with higher copays. SNP plans are not available everywhere. It really depends on the state, the county, and the zip code. Some areas might have a dual eligible plan, some might have an institutional, and some might have a chronic needs. So it really depends on which county you live in and your zip code. Medicare Special Needs plans must provide you with the same benefits, minimum as original Medicare. But you can have, again, different rules, restrictions, and cost. SNPs, as we mentioned that before, can offer additional services. And if you have specific questions about these plans, just give me a call or text me. Plans might charge monthly premium in addition to the Part B premium, or there are 0 premium plans available. Plans may set their own deductibles and copays and other cost sharing for services if you have Medicaid, and you should not pay any Medicare deductibles or copays while seeing your providers if you do have a dual eligible plan. So if you do have a dual eligible plan, and that means you're on Medicare and Medicaid, you should not be paying any deductibles or copays. For the providers, plans may help to manage your care through care managers by providing access to these care managers who will assess your specific needs, provide supervision, coordination of your Medicare and Medicaid benefits if you have been enrolled in a dual eligible plan. Depending on your plan, you may have coverage for out-of-network care. However, You may have higher amount of out-of-pocket costs, and you will need to check with the plan before you're seeing any out-of-network providers. A SNP plan in general cannot charge more than original Medicare for certain kind of cares, including chemotherapy, dialysis, skilled nursing facility. However, SNP plan can charge higher copays for other services, including home health, durable medical equipment, and inpatient hospital. On the benefit side, all the SNP plans are required to provide a Part D coverage, which is the prescription coverage. Your SNP plan may offer additional services, vision, hearing, dental, transportation, over-the-counter benefits, or also, sports supplies and things like that. Excuse me. So check with the plan director, give me a call, and then we can see, what coverage rules and restrictions are available or added benefits. To qualify for Medicare Special Needs plans, you must apply and prove that you meet the SNP eligibility criteria. The SNP plan will require periodic proof that you continue to meet these criteria. And I'm more than glad to help you with these processes. So, for example, with the chronic condition special needs plan, the eligibility requirements are: you must get a note from your doctor confirming that you have the condition which is addressed in that plan. The chronic special needs plan may enroll you before you get this confirmation from your doctor, but if you cannot get verified, your eligibility will end of your first month enrolled, and you will have to disenroll from that plan by the end of the next month. Now that will give you a special election period, which means you can enroll into any kind of a new plan, beginning with the first month notified by your plan that you're being disenrolled, and it's ending 2 months after. When can you enroll? If you have a severe, disabling, or chronic condition, you can enroll in a specific plan, special needs plan, serving people with that specific condition at any time, as long as you have that condition. For the institutional eligibility requirements, you must either live for at least 90 days in a long-term care facility that is served by the plan, such as a nursing home, intermediate care facility, or for the mentally retarded, or you meet your state's guidelines for requiring a nursing home level of care for at least 90 days, whether you live in an institution or in a community setting, for example, in a home or group home. You can still qualify for an institutional special needs plan before you have received your care for at least 90 days, if it's likely that you will need long-term care for at least 90 days. And then the eligibility requirements for our dual eligible plan. You must verify that you have Medicaid or a certain level of Medicare savings programs like QMB, SLMB, and we need to verify your Medicaid status. I'm seeing a lot of folks who don't think they're eligible, but they are. If you are not sure, please let me know. I have tools to check your eligibility. Certain D-SNP plans only serve beneficiaries with Medicare and full Medicaid benefits. If you have a certain level of Medicare savings program, you will not qualify, and you must find a D-SNP plan that serves people with that Medicare savings program, in addition to people with Medicaid. Plans cannot exclusively serve only Medicare savings programs. If you meet the SNP eligibility requirements, you can join the plan during regular Medicare Advantage enrollment periods. But you also have a special enrollment period you can enroll anytime during the year and change plans one time during each of the first 3 quarters of the year, which means during the first every 4 months you can change except the last quarter, or when you just became eligible for Medicaid. And that special enrollment period lasts as long as you have both Medicare and Medicaid. And again, I'm more than glad to help you to apply online for Medicaid, because again, I have seen too many people, they think they're not eligible or they have not even thought about the eligibility. And I'm more than glad to talk to you about those requirements. And I'm more than glad to help you with verifying your status. I have the state applications for Kentucky here, so I can forward that to you. That's not a problem. Now, if you're enrolled in a Medicare Special Needs plan but no longer meet the eligibility requirements, for example, you're losing Medicaid, the Special Needs plan may continue to provide coverage for a period of time, and it seems likely that you will regain eligibility for the SNP plan within this time frame. And depending a little bit on the plan, you may have between 30 days and 6 months to regain your eligibility. And if you do not regain it during this time period, you will be disenrolled by the plan. You should receive written notice from the plan within 10 days of learning that you no longer meet the eligibility requirements, and you will have then a special enrollment period to find a new Medicare Advantage plan, or you can go back to original Medicare and just prescription drug plan. Now, the questions you should definitely ask before enrolling in a special needs plan, here are some ideas. The first one is always, am I even eligible for any of these special needs plans? They're available in my specific area. How does the special need plan service compares with this available other plans in my area? Regular Medicare Advantage plan, how does it compare to original Medicare? What benefits does the SNP plan provide me will help my specific needs? For example, chronic special need plans. What special services does this plan offer to help manage my specific condition? Does it cover specialists that I need to see? With the institutional plans, will this plan improve my care experience in the nursing home? Will I have regular access to nurse practitioners or other providers? Do I? And for the dual eligible plan, does this plan coordinate my Medicare and Medicaid benefits so it makes it easier for me? What cost should I expect from this coverage? Premiums, deductibles, co-pays. Is there an annual limit out-of-pocket expense? Will I be able to use my doctors? Are there is there a network? You know, if I join an institutional plan, will this plan be in the network and include my nursing home? Will it include my home health care? Are the plans and network providers and facilities in a convenient location? Does the plan provide coverage for services I receive from out-of-network providers? Do I need a referral to see a specialist, or can I just go directly? Are all my drugs on the plan's formulary? What special accommodation does this plan make for a person with disability? What special languages or culture accommodations does this special needs plan make? So these are questions I definitely would ask myself or ask an agent as the plan. These are really important questions because it affects your personal situation. If you have questions, again, give me a call. You can private message me if this is, if you prefer that, or you can just post a comment in the box. I give this back to Nicole and see if there are any questions already out there. Nicole.
I am looking on the Facebook. Hold on just a second so I can see if we have any comments. And We don't have any comments as of right now, but like Saskia said, if you have any questions or concerns, her number is there, or you can contact our extension office, and we will be back next month.
Thank you so much again, and you guys have a wonderful rest of the day.
Thank you.